Title: The Path to Equality for Women and Young Persons with Disabilities.
1 in 7 people worldwide is a person with a disability. That's an estimated 1 billion people. We are leading efforts to make the world more equitable and inclusive by raising awareness of disability, setting standards for inclusivity, and championing legislation to advance our rights. But we face unique, multi-layered challenges compared to our peers, particularly when it comes to accessible information and services on sexual and reproductive health and rights, and gender-based violence prevention and response.
Text introduces Herman Turan, Uruguay. A man uses sign language to address us. Subtitles read, "We, persons with disabilities, have rights. We are backed up by the Convention on the Rights of Persons with Disabilities." Text introduces Setembila Mabuza, Iswatini. Subtitles read, "We are also human beings. One day, I also want to have a family. I want to have a husband and children. The only difference in me is that I have a disability."
Approximately 1 in 5 women has a disability, and 180 million to 220 million are young persons, with around 80% living in developing countries. We face barriers that restrict our agency and put us at increased risk for unintended pregnancy, pregnancy complications, sexually transmitted infections, including HIV, abuse, exploitation, and forced and involuntary treatment. We are often judged if we want to be in relationships, be married, or have children.
Abia Akram, Pakistan.
When we talk about the sexual health and reproductive rights of women, especially the young girls with disabilities, it's so challenging because of the stigma, the discrimination, and all the violation they are facing.
Women and young persons with disabilities are more likely to face gender-based violence and less likely to have full and equal access to prevention and response services. So when we experience violence, we often can't access services. We envision and work toward a world where all people feel safe in their relationships, their societies, and their homes, and are free to be themselves. We are determined to overcome the obstacles we face, and we welcome you to work with us. Global conventions and agreements, like the Convention on the Rights of Persons with Disabilities, the Convention on the Elimination of All Forms of Discrimination Against Women, the Convention on the Rights of the Child, the International Conference on Population and Development Programme of Action, and UN's Sustainable Development Goals provide frameworks guaranteeing our rights to exercise our sexual and reproductive health and rights and live free from gender-based violence. International conventions require states to put in place legislative and legal protections for persons with disabilities, combat harmful stereotypes and stigma throughout society by raising awareness, including at the family level, and affirm that all persons, including those with disabilities, are equal in the eyes of the law. What's the best way to achieve these conventions? By involving us and amplifying our efforts. Persons with disabilities are the best resource to inform decision-makers on how to accomplish these agreements. We decide.
Jacqueline Waiharo, Kenya.
When they are making laws, when they are having campaigns, when they have civic education, they should involve people like us.
We can best speak to our needs and the challenges we face from accessing services to information and education about relationships, parenthood, contraceptives, and other topics.
Chrissy Zimba, Malawi.
As a person with a disability, I would like others to know that people with disabilities have the same sexual and reproductive health needs as their able-bodied counterparts, and yet they face barriers to information and services.
Natalia Farias, Uruguay. Subtitles read, "I think it is basic and very important that persons with disabilities are not seen as eternal children."
Que la persona con discapacidad no sean miradas como apenas niños.
Girls and young women with disabilities have the lowest levels of sexual and reproductive health information and education. Research shows that several factors combine to discourage persons with disabilities from obtaining information and services, including the effects of poverty and exclusion, service providers' ignorance about disability, communication barriers, lack of physical access, and attitudes towards persons with disabilities.
Text introduces Lucy Meyer, United States.
Yes, I learned about sex education in school, but I did not know that I learned about it because it was not taught to me in a way that I was able to understand.
Sofia Savoy, Argentina. Subtitles read, "The professionals working in the area of sexuality are very poorly prepared about how to react, how to work when a person with disabilities comes asking about this subject."
In a recent study, 20% of women with disabilities had never used any sexual and reproductive health service. When we do receive services, it is not always with our informed consent. Women with disabilities, particularly those with intellectual disabilities, have long been subject to forced use of contraceptives or sterilizations in our supposed best interest. This example is just one of the ways we may be targeted for gender-based violence, including harmful practices, because of our disability. Women with a disability are more likely to experience violence than male peers with a disability, or female peers without a disability. Strong evidence from countries as diverse as Nepal, Uganda, the United States, and Australia shows very high rates of violence against women with disabilities. And while we experience many of the same forms of violence that all women may face, as the authors of the Forgotten Sisters report describe, when gender and disability intersect, violence takes on unique forms, has unique causes, and results in unique consequences. Recent research compiled through the UNFPA's We Decide program found that around the world, young persons with disabilities, especially girls, are far more vulnerable to violence than their peers without disabilities. Those under age 18 are almost 4 times more likely than their peers without disabilities to be victims of abuse. Young persons with intellectual disabilities, particularly girls, are at greatest risk. We also experience mistreatment or controlling behaviors from intimate partners, caretakers, or others.
Carly Jones, United Kingdom.
We need to be aware the amount of autistic women and girls who end up in very controlling relationships. Control can look a lot like care.
Controlling behavior is often mistakenly normalized as protection rather than properly identified as abuse. Despite these heightened risks, we often can't use prevention and response services because of lack of accessibility, discrimination, and social isolation. For these same reasons, we're often denied access to fair and equal treatment from law enforcement and courts of law. Those of us with intellectual disabilities face a higher risk of being denied legal capacity, making it even more difficult to access justice services.
Anissa Byukusenge, Rwanda.
I dream of the world in the future where everyone's testimony will be valued, not depending on any type of disability.
We may be discriminated against for many reasons. More research and programming are needed to better understand how stigma and multiple forms of discrimination intersect and compound the disadvantages we face. For instance, refugees and displaced people face an added layer of challenges and rights violations because responses to humanitarian and emergency situations are often not accessible or inclusive. All of these facts sound overwhelming, but changes are happening daily that give us hope. And more concrete steps can be taken to address the challenges we're facing. Disability inclusive, gender equitable, and youth-friendly policies and programs can be created and implemented to better realize our rights. Many countries have laws and policies that recognize gender equality and the right to health and safety for all citizens. But only some have laws and policies specifically and adequately addressing persons with disabilities. Even where legal frameworks exist, available services may still need improvement. Community and facility-based service providers can be provided knowledge and skills to ensure their services and programming are accessible to everyone and of high quality. Service provision criteria for availability, accessibility, acceptability, and quality of care are fundamental to realizing the right to health. Many other tailored resources are also available, such as service provision guidelines from UNFPA and Women Enabled International. This and other resources provide step-by-step instructions for service providers to ensure full accessibility. Such actions are more effective, inclusive, and sustainable when taken in partnership with disabled persons organizations.
Abia Akram, Pakistan.
Women with disabilities need to be worked as advocates and as leaders. If we engage their perspective, it will be much easier to make our environment more inclusive for women and girls with disability.
Let's work together by taking concrete steps to ensure our sexual and reproductive health and rights are fully realized, and to combat the gender-based violence we face, no matter where in the world we live. States should commit to and implement the Convention on the Rights of Persons with Disabilities, as well as the full elimination of discriminatory laws and regulations, and ensure that rights violations are outlawed and that those laws are enforced. States and partners should take a twin-track approach by ensuring that we are fully included in all laws, policies, and programs, and creating targeted programs when necessary to address our specific needs and risks. Government agencies and civil society organizations must learn from and collaborate with each other and ensure our participation and leadership and that of our representative organizations. States, donors, and lending institutions must ensure full inclusivity within their organizations and their programs. They should also allocate more resources to ensure sustainable partnerships with disabled persons organizations, full accessibility, and adequate policy implementation. Service providers should adopt an approach of availability, accessibility, acceptability, and quality in the provision of all services. Communities, families, and individuals should work to combat the stigma we face, promote positive attitudes towards us, and support a full realization of our rights. Research institutions and governments should collect more data on disability and disaggregate all data by disability, sex, and age. Data are critical to understand our situation and inform policies to ensure our social inclusion and human rights. It should be made publicly available and accessible to us.
Jacqueline Waiharo, Kenya.
As a person with disability, I completely accept myself, and you cannot expect me to blend in when I was born to stand out.
Partner with us. Together we can build a more inclusive society.
Logos appear for AECID, We Decide, UNFPA, and PRB. A list of acknowledgements appears, with special thanks to several individuals for their contributions. A list of image credits appears. Narration by ASAP Studio. Music by Audio Jungle. Text appears. Thank you to all those who submitted personal testimonials of their experiences.